This is some of the armamentarium that is required for a rubber dam application. We have, very importantly, the rubber dam, which comes as 6 into 6 inch sheets, as light, medium and heavy. We have a template for ease of application, and the sheet can be placed over the template. The markings can be made. There is a punch, a forceps, an application forceps, and a frame. We have different types of clamps, the winged clamps and the wingless clamps. The wingless clamps come with a marking of W. We also have accessory clamps, which are the Brinker tissue retractors and or the Brinker accessory clamps. We also need some floss to go through. It is very important to tie a piece of floss through the clamp in order to secure the clamp safely. So fold a piece of floss and thread it through, and once you take it out, you have a small loop. And then the loose end or the free end can go through the loop, and now we have the floss secure. Now this is simply not sufficient on its own, because occasionally you can have a clamp which breaks through in the middle, and then you can't have security here, so you need to thread it down over, and once you thread it down, you have something like this, where it passes through the opposite side and exits out through the other. So if you do have a clamp breakage in the center, then you have a secure floss which can retrieve it from the mouth. Many sizes of the punches. We have a 1, 2, 3, 4, 5. What usually works for a molar is a large punch, and you can use smaller punches like a size 4 or a 3 for smaller teeth, depending on the size of the teeth. When you have to punch, make sure that the sheet slides over, and then as you punch, lift the sheet towards you so you have a nice straight punch like you have there. The rubber dam technique is an inexpensive and very effective means of isolation. The gold standard of isolation is still the rubber dam, which is very effective for all modern day endodontic and restorative procedures. With a little bit of training, every one of you can incorporate this simple technique into your dental practice and use it every day.